Today, we are going to talk about the top 3 vitamins to stop cramps and that restore leg strength in seniors. As a doctor of physical therapy, I've helped many seniors with weak legs and painful cramps. And today, I'm going to share with you some really practical tips on what you can do at home to get rid of the cramps and to strengthen your legs. If you are new here, welcome. This is a channel where you will find helpful tips and exercises to improve your health and your quality of life. So if you like this video, please subscribe so you don't miss my next video. In this video, I'm going to discuss the 3 most common causes for leg cramps and weakness in seniors, and I'm going to share with you which vitamin can help you with each condition. Now, before we begin, I need you to understand that this video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. With that being said, let's go over the 3 vitamins. One is vitamin D. Many people are deficient in vitamin D and don't even know it. Vitamin D is extremely important for our immune system, for our bones, for our muscles, and even for our mood. So how do we get vitamin D? Well, our body makes vitamin D when our skin is exposed to the sun. But unfortunately, many people don't spend much time outdoors, especially during the winter time. Additionally, as we age, our skin becomes thicker, and this makes it more difficult for our skin to absorb vitamin D from the sun. Now, it is possible to get vitamin D from certain foods, such as fatty fish or from supplements. However, many people still don't get enough vitamin D. One of the symptoms of vitamin D deficiency is muscle weakness. Muscle weakness due to vitamin D deficiency can affect any muscle in the body, but in particular, it can affect the muscles around the hips and in the lower legs. Now, these muscles are responsible for walking, for balance control, and for preventing falls. So when they become weak, it significantly increases the risk of falling. In fact, studies show that approximately half of all adults older than 50 years old with a vitamin D deficiency will fall at least once per year. The reason why vitamin D deficiency causes muscle weakness is because vitamin D helps our body absorb calcium. And calcium is a mineral that is essential for strong bones and for healthy muscle contractions. Now, without vitamin D, our body cannot absorb calcium properly, and this results in low calcium levels in the blood. You see, our muscles need sufficient amounts of calcium in order to contract properly. So if our blood levels of calcium are too low, this will result in muscle weakness. Another symptom of vitamin D deficiency is painful muscle cramps. This happens because when there is a vitamin D deficiency, the parathyroid gland tries to compensate by releasing a hormone that pulls calcium out of the bones. This process can cause muscle spasms and painful cramps, particularly at night while you are sleeping. So how much vitamin D do we need? Well, the Institute of Medicine determined that a daily intake of 600 IUs of vitamin D is sufficient for most adults younger than 70 years old. However, after 70 years of age, the requirement increases to 800 IUs per day. It is important to note that many doctors recommend taking higher doses of vitamin D, and I agree. However, I must emphasize that you should always follow the instructions on the label of your vitamin D supplement or talk to your doctor to determine the right dose for you. Now, if you want to learn more about vitamin D, I'll link a video in the description below that discusses 10 ways that vitamin D can improve your health. The second vitamin is calcium. As I mentioned earlier, calcium is an essential mineral for strong bones and for proper muscle contraction. But did you know that approximately 50% of all seniors have low levels of calcium in their blood? There are several reasons for this. First, as we age, our intestines become less efficient at absorbing calcium. Second, as I mentioned earlier, our parathyroid glands work overtime trying to pull calcium out of the bones when we have a vitamin D deficiency. And third, many people simply don't consume enough calcium through their diet. Well, as you may have guessed, Low levels of calcium in the blood can cause muscle weakness and painful leg cramps. In addition, low calcium levels can cause other problems such as osteoporosis, which is a disease that weakens the bones and makes them more likely to fracture. A severe drop in calcium levels can also cause a medical emergency called hypocalcemia. Hypocalcemia can cause seizures. It can cause arrhythmias, which are abnormal heartbeats, and it can even cause the person to go into a coma. Fortunately, most cases of low calcium levels are relatively mild and can be easily treated by increasing the intake of calcium. Studies show that an intake of 1,200 milligrams of calcium per day is sufficient to increase the blood levels of calcium and prevent a deficiency. However, this is only true if you are also taking sufficient amounts of vitamin D. If you aren't, then the parathyroid gland will continue working overtime to pull calcium out of the bones, and this will lead to weak bones and continued muscle weakness. Now, it is important to note that excessive amounts of calcium in the blood can be dangerous. Therefore, it is recommended that people younger than 50 years old do intake more than 2,000 milligrams of calcium per day. However, after 50 years of age, the recommendation is to limit the intake of calcium to 2,000 milligrams per day. Again, I must emphasize that this is just a general rule. Always follow the instructions on the label of your supplement or talk to your doctor. There are many different types of calcium supplements available, and the type that you choose depends on your personal needs. For example, calcium carbonate is a very inexpensive form of calcium, but it has a low absorption rate. This means that your body will absorb calcium from this supplement very slowly, and this can lead to higher amounts of undigested calcium in the stool. The higher amounts of calcium in the stool can lead to constipation. On the other hand, calcium citrate has a higher absorption rate, so less calcium is wasted in the stool. In addition, it does not contain as much calcium, so it is less likely to cause constipation. Because of this, I recommend taking calcium citrate. The third vitamin is magnesium. As I mentioned earlier, when we have a vitamin D deficiency, the parathyroid gland works overtime to pull calcium out of the bones. This can result in low levels of magnesium in the cells. Low levels of magnesium in the cells can result in muscle weakness and painful cramps. In fact, research shows that correcting a vitamin D deficiency also corrects low levels of magnesium in the cells, and it gets rid of the cramps. Low levels of magnesium in the cells can also result from taking diuretics, medications that are used to treat high blood pressure and fluid retention. Muscle weakness and painful leg cramps are just two symptoms of a magnesium deficiency. Other symptoms include fatigue, irritability, insomnia, and even seizures. Unfortunately, most people don't get enough magnesium through their diet. And this is a problem since getting older. Having a chronic illness or taking certain medications can make the body lose more magnesium. Our bodies do not store large amounts of magnesium, so you must replenish it every day through your diet or through supplements. Research shows that 400 milligrams of elemental magnesium per day is sufficient to prevent a deficiency. Now, there are different forms of magnesium supplements, and each form has its own advantages and disadvantages. For example, magnesium oxide is inexpensive and has a high absorption rate, but it can cause diarrhea. On the other hand, magnesium citrate is well absorbed, and it doesn't cause diarrhea, but it is more expensive. I recommend taking magnesium citrate because it is very effective and it doesn't cause side effects. So how do you know if you have a vitamin D deficiency, a calcium deficiency, or a magnesium deficiency? Well, fortunately, you can get your vitamin D levels checked through a simple blood test. If the vitamin D level is less than 30 nanograms per milliliter, then you are considered deficient. In regards to calcium, low levels in the blood can indicate a vitamin D deficiency, a parathyroid problem, or a kidney problem. So you would have to have additional testing to determine the underlying cause. In regards to magnesium, Low levels in the blood can indicate a vitamin D deficiency, a kidney problem, or a parathyroid problem. Once again, you would have to have additional testing to determine the cause. If you want to learn more about how to strengthen your legs, check out these videos. Thank you so much for watching, and I look forward to seeing you in the next video.